What's going on, animators? Aaron here. I want to just go over a few quick tips for getting connectivity in your smiles. There's something that they call the Duchenne Smile. The term was coined by psychologist Dr. Paul Ekman, who's one of the leading voices over the past 50 years or so in facial research. And it was named after a French anatomist, Guillaume Duchenne. And basically what he had discovered is that a smile that's generated from just firing the zygomatic major muscle, which runs in this direction and pulls our mouth corners up, isn't as tied to genuine, true emotion of joy or happiness as a smile that both includes that zygomatic major muscle, which we call action unit 12 from the facial action coding system, as well as a smile that includes both action unit 12 as well as action unit number 6, which is the flexion of the orbicularis oculi, will read as a more true and more genuine smile, and is usually more directly tied to feelings of true joy. So what we'll often see in animation is if you're not thinking about connectivity in the different muscle groups and you're just bringing up the mouth corners, it can often read as what we call a polite smile. This is something that we've sort of adapted and learned to do in social situations where maybe we're not genuinely happy, but we know it's appropriate to smile. Maybe you're meeting someone that you don't particularly care for, or your boss walks in the room or whatever. You just kind of flash that smile. That's usually just going to include involve the mouth corners, and not involve the eyes as much. So what I've done here is I've kind of stair-stepped individual muscle groups here on Eugene. You'll see here we're starting from default face, and this is with just the mouth corners pulling up, basically. A little of the lowering of the lip as well, raising of the upper lip to see the teeth. But this is what we would kind of call sort of just like a polite smile, where you're just sort of flat, bringing up the corners and flashing that smile. You're kind of flexing your zygomatic major muscle that's pulling up these mouth corners. But as you see here, we're not getting any connectivity in the nose or cheeks or eyes yet. And so if you were to animate this wouldn't be a particularly successful smile for a number of reasons, right? It just doesn't have enough connectivity, and we're not really respecting the underlying facial anatomy enough in terms of the muscle groups that are moving. So this is with just the corners coming up. So the next thing I would do is probably include some nose, like pulling the nose with those corners and showing a little flexion there. So that's what I'm doing here, getting a little involvement with the nose. So you can see that starting to move as well. So it starts to feel like we're engaging some of this region as well. But we could go further. We could involve the cheeks some. Now you see I'm moving the cheeks as well as the nose, so we really feel this zygomatic muscle starting to pull. But this is still just reading as, again, what we would call a social smile, a polite smile, right? This is not really, sometimes you'll even hear it referred to as a Pan Am smile. It's kind of flight attendant smile. So if you looked at this by itself, there's nothing inherently wrong with this anymore. It's including enough of the muscle groups. But if you want your character to really feel like they're experiencing true joy, like they're actually excited, you definitely want to get these this orbicularis oculi muscle, this kind of A6 action unit involved. So this is going from the default to that. And so the telltale sign of this Duchenne smile, sometimes you'll hear it misquoted as crow's feet. If you have a realistic enough rig that you kind of get that wrinkling on the side of the eyes, that's sometimes one indicator. But actually what you're actually looking for is this upper eyelid fold that kind of pulls down. You'll kind of feel it pull down on the outer region of the eyebrow even, and that's showing that you are truly engaging that orbicularis oculi muscle, that it's actually flexing there, in addition to sort of the crow's feet wrinkling. So you can get the crow's feet wrinkling just from the cheeks if you're really pulling your corners high but not necessarily engaging your orbicularis oculi. You can already start to get the crow's feet just from pushing up the cheeks, which gives you some of the squint here. But here you see that entire all of these muscle groups firing. So you're getting the mouth corners, A12 as well as A6. And so this is what you really want if you're after a smile that feels genuine, if your character is actually experiencing joy and they're not actually masking or pulling off any deception or just doing, kind of a polite social smile. So just something to keep in mind as you're kind of building your facial shapes and tying them to the character's emotion, that if you do want it to come across as reading as true and genuine in that way, go ahead and include some of that tightening of this muscle group, and you can see that here as I flick between it, versus this one that was not including the eyes. So just a nice tip for you there. If you're interested in learning more about the face, we are kicking off our facial animation boot camp in just a few weeks. We have some spaces left. We're going to be taking a deep dive for 4 weeks, 8 sessions, covering all things facial expression, facial appeal, facial posing, as well as facial animation, lip sync. And you're going to walk away with a really deeper understanding of how to play the instrument that is the face, to connect with your audiences and communicate ideas in that way. So we hope you'll join us. Head on over to thecgriff.com for information, more details, and to register. Hope to see you there. Bye.